Hey guys, good evening. We have Dr. Amit joining us today, and Amit is an endocrinologist, and he's here to talk about COVID and diabetes, especially what diabetes patients can do during this situation. What are the precautions they need to take it? So sorry with that. So he's currently with King's Hospital, which is a pretty renowned hospital in Secunderabad. And he also has his own clinic, which is Amit Clinics, which is based out of Vikrampuri, Hyderabad. So, Dr. Amit, thanks for joining in, taking time out for this. And yeah, friends, Pulse Pharmaceuticals has actually sponsored this particular event so that we can share this particular knowledge about diabetes. There are a lot of people who are already diabetic. There are a lot of people who are very close to getting diabetic. So, Dr. Amit, maybe you can talk about your journey, quickly introduce yourself, and then we have a lot of questions in our mind which we want clarity about.
Yeah.
Over to you.
So thank you so much, Ravi Shankar. Thank you, Work Health, and I am very happy and thanks once again to Pulse Pharmaceuticals for sponsoring this event for educating our masses. So I am an endocrinologist based out of Hyderabad. I work at Kim's Hospitals. I am basically a consultant endocrinologist at Kim's. I run my own clinic called Dr. Amit Diabetes Endocrine and Super Specialty Clinic at Vikrampuri Colony, Secunderabad. So what is endocrinology? A lot of people do not know what is endocrinology. So endocrinology is a branch of science which actually deals with hormones. So hormones are a big field by itself. So what does an endocrinologist do? So endocrinologist is a super specialist dealing in diabetes, thyroid, hormone-related disorders such as height problems, sexual disorders, or some ladies who do not have menstruation or have menstrual irregularities. We also deal with them. So this is a varied branch where we see day in and day out. So now in this pandemic situation, diabetes and COVID is the most sought for, which I wanted to speak to all our viewers. So once again, thank you. Thank you for having me on the show. And we can start. I guess we can start the show.
Yes, sir. So the common thing is what are the symptoms of diabetes, and when should they consult
Yeah.
you?
Yeah. So the symptoms of diabetes, if you look at, again, varies from age to age. So if I have a child or if I have a teenager who's coming to me at my clinic, that person or that child might just come with just loss of consciousness or feeling tiredness, or sometimes the parents start noticing that the child is being very drowsy, is unable to concentrate, and the most commonest features are excessive urination. So if a diabetic patient comes into our clinic, we see that they are drinking, they are excessively thirsty, and also they are excessively passing urine. Their intake of food, so they have a hyperpolyphagia. They increase hunger, increase thirst, increase urination. So they go frequently to the toilet. That is one more.
Mhm.
In children, we see something called as a medical emergency or a diabetic emergency called as diabetic ketoacidosis. So a patient just goes into a semi-comatose like state suddenly, and then when you look at their sugars might be as high as 600, 700. So that's the eventual presentation in a child or in a teenage child who comes to us with diabetes. That is called as a type 1 diabetes. If you look at the more commoner which we see in our general practice and more common so in the whole country or in statistics wise is type 2 diabetes. So type 2 diabetes, they are more obese, so the weight is more in type 2 diabetes. They have symptoms like excessive eating, thirst, excessive maturation, but only about say 5% might develop with this diabetic ketoacidosis. It's very uncommon to develop this kind of an emergency where they have a semi-comatose or comatose. The more other presentations of diabetes in type 2 diabetes mellitus are patients start losing weight. So losing weight can be one important sign to catch that the patient might be diabetic. Or
Okay.
lady or a woman getting recurrent infections like urinary tract infection or boils which are not healing or any wound which is not healing can point towards diabetes. So these are the commonest presentations. Then we have certain other certain other forms of diabetes like secondary diabetes, which are a little rarer in comparison to type 1 and type 2 diabetes. They are like called as fibrocalcific pancreatic disease. So a patient presents to me with just loose stools or feels oily stools. They
Hmm.
pass motions which are oily in nature. They have decreased hunger, and when you look at, they have certain stones in and around their pancreas. So that causes insulin not to be secreted well. So that's why that is called a fibrocalcific pancreatic disease. As an endocrinologist, I also see a few other uncommon forms of diabetes which the people should know, such as secondary diabetes. Like, someone is like Khali. So great Khali was acromegaly. So acromegaly is when there is excessive growth hormone. That excessive growth hormone that comes from the pituitary, basically it comes from some small part in our brain called as pituitary gland. So the patient has increased size of their finger rings, or their chupples are getting increased. They have a protruding jawline. They are too tall. Their voice starts to become sonorous voice. They have a changed voice. They can present with diabetes which is uncontrolled. So one thing is they would require a very high amount of dosage of insulin or tablets. So that's when we start investigating our patients retrospectively to know if it is a other form of diabetes. So diabetes only people think is a simple type 2 diabetes, but it has various forms of presentation. So the most commonest take home is type 2 diabetes. In younger children and lean patients, we see type 1 diabetes and other forms of diabetes like secondary diabetes, which I was speaking.
Okay. So which one is more dangerous, or where precautions have to be more, type 1 or type 2?
Uh, See, type 1 diabetes has to have a tighter control because they are more prone to have complications. So see, anything is not dangerous in per se diabetes, but the diabetes causes a lot of complications. So what they have seen that type 1 diabetic patients, if uncontrolled and not controlled at the earlier phase of diagnosis, is more prone to have complications. So in diabetes, you see two types of complications again, such as micro and macrovascular. So there is micro in the sense like your eyes, your retina is getting involved. So you have bleeding in your retina, you are unable to see properly. Your kidneys might be affected. Your nerves might be affected.
Oh my God.
So these are called as micro. Macrovascular are your cardiac issues. You start getting a MI, heart attack like picture. So these are all dependent on how well you control your diabetes. So if you are well controlled, you visit your doctor very often, you take care of your exercise and diet pattern, you are definitely as normal as another individual. So your risk only increases, but you will not be having those complications. So complications have to be avoided. The goal of treatment in diabetes is to have lesser complications.
Okay. So, coming to the topic, COVID, and people who are already diabetic or having diabetic symptoms. So, what precautions should they take?
Yeah. So now, as we know, COVID is a viral infection. It's a virus. So precautions. So what as literature suggests that COVID patients are at a mild increased risk of developing. Diabetic patients are at a mild increased risk of developing COVID, and those diabetics who have developed COVID had severe form of COVID who were uncontrolled. So patients who are diabetic, who are well controlled, had COVID, which was as normal as another individual who was non-diabetic. But if you are a diabetic and you did not have a good control, your HbA1c, that's a 3 months average, was more than 9%, you are more prone to have a severe form of COVID. So what are the precautions is the universal precautions stay well good for diabetes also, like wearing a mask, doing a social distancing, using a sanitizer. In specific, you would have to keep a very good control. So what we are observing is we advise our patients that use a glucometer, which is a machine which is for self-monitoring of your blood glucose at home. Ideally, monitor it at least once in a week to once in 2 weeks if you are unable to maintain your targets. So what are our targets in diabetes? Is fasting. Sugar should be around 80 to 130 postprandial. That is after you eat and you take it after 2 hours should be around 160. So if you are unable to maintain your target or your HbA1c should be less than 7% ideally. If you are unable to maintain this target, you should consult your endocrinologist or your other doctor, whoever is nearby to you, over at least telemedicine. So in 2020, telemedicine is approved by the Medical Council of India to consult us by video conference or video call. So we would suggest that these targets have to be followed and monitoring. And what one more thing which we are seeing as doctors commonly is patients have stopped to take their medication. So please do not stop your medication. Do not be under an impression that once the course. Suppose I have written a 3 month course, certain of the individuals just stop it abruptly. So either ideally talk to your doctor to stop it or not to stop it. So if you're stopping it, your sugars might go up high, which will lead to an increased risk of infection. So my sincere advice is please do not self-medicate or self-stop it. Please consult your nearest doctor.
Great. So there are a lot of influences of advertisements. Not only on the TV, but there on social media. There are a lot of alternate medicines that are coming up. So do you suggest the patient should switch from whatever they're taking to some of the?
So what I have seen of alternate medications, you see, there are certain forms of generic medications which are available in the market and certain alternative medicines which I am not an expert of. So my suggestion is, see, I am an allopathic doctor. So my suggestion is, certain of the individuals have a wrong concept that allopathic medications cause more harm than the alternative medication. But I would contradict the statement because we have certain studies which have shown that certain alternative medications cause worsening of certain other things. So it's the patient discretion, but as a specialist, I would say you should meet your allopathic doctor. If you are not satisfied and you're not following what we are telling and you're not able to achieve the control, then you're most welcome to switch over to alternative medication. But definitely, see, if you look at history, the English medicine has been there from a longer time. And we are all here, we have all spent our years, teenage years, school years, and then so on and so forth in medicine to, do good to the people. So my suggestion is please follow what we are telling judiciously, then try. So what we have seen as doctors is everyone wants an instant remedy.
Hmm.
So, you have to have a list of certain things when we tell you to follow. The compliance is a very important thing in diabetes control. Diet is a very, very important thing in diabetes control. Exercise patterns are very, very important. So, it's a metabolic disorder. Patients should understand that all these together will definitely cause a good diabetic control.
Yeah. So you were talking about hormone control, as one of
Yes.
your specialties. So people who have imbalances like hormone imbalance, thyroid, and all that. So are they prone to diabetic? Is that any
Uh,
influence by any
no, there
nature?
is no direct correlation, Ravi Shankar Prasad. There is no direct correlation of thyroid and diabetes,
Okay.
but there is definitely correlation of certain hormones like cortisol hormone, the growth hormone, and so on and so forth, which actually worsen your diabetes. So
Okay.
these are all secondary forms of diabetes, but no, thyroid and diabetes do not go hand in hand. But yes, we have seen a lot of patients having both of these together.
Okay.
So type 1, if you look at type 1 diabetes and hypothyroidism come from the same common precursor. So it's like a tree.
Hmm.
The root cause in type 1 diabetes and hypothyroidism in a type 1 diabetic is the root cause is autoimmunity. So in
Okay.
our body there are certain things which are entering, start to fight with our body cells and then damage our own body. So autoimmunity is nothing but something is entering into your body, triggering an immune reaction to your uh, antigen which is entering and then causing an antibody damage. So there is auto antibodies which are being produced against this antigen. So the common root cause in type 1 diabetes and thyroid can be related, but not in type 2. Type 2 is a different topic altogether.
What are the warnings for people when they have high blood sugar, and what are the warnings for people who have low blood sugar? So what are
Yeah.
the precautions they need to take in?
Yeah. So first I would answer about low blood sugar. See, low blood sugar is something called as hypoglycemia. So that term is hypoglycemia where your sugar levels fall below 70. So once if a patient falls below 70, has sweating, has tremors, has shakiness, or is feeling dryness of the tongue, is unable to move. Sometimes, some patients might develop seizures also. They might develop a fit because of low sugars, because the glucose doesn't reach your brain. So these can be certain warning signs of sugars being low. So what we advise our patient is to, if you are a patient who's old or a patient who, irrespective of the age, is on insulin, I advise my patients to have a glucometer and I tell them the symptoms of hypoglycemia and I advise them to check it. So if the glucometer reading shows less than 70, you have to take a 15 grams of anhydrous glucose, that is a glucon D, mix it up in water and take it. And then later check it after 15 minutes. If still the sugars are like this, less than 70 odd or so, you will again have to repeat the procedure till it rises at least above 100. And connect to your doctor immediately who is nearby. But in case the patient is comatose, is not responsive, he is a diabetic, we advise our patients to have a glucagon shot. So there is a glucagon injection which is available in the market. We train our parents who are for type 1 diabetic. If the child is unresponsive suddenly, we ask them to give this glucagon shot as subcutaneously under the skin, and then the patient might, have levels which are elevated and can be brought to the casualty or emergency.
Okay.
So this is for hypoglycemia. Hyperglycemia can conversely have, weight loss, can present with a very bad urinary tract infection, or sometimes we see a very bad high-grade fever can come. So its fever is because of the infection somehow, or a patient might just develop very drowsy, very lethargic, is when he gets a fruity odor from the mouth, is unable to walk. So these can all be warning signs that there is an impending diabetic ketoacidosis. So there is what this diabetic ketoacidosis is, when the sugars are too high, they convert into certain acid. It triggers a reaction where it forms certain ketone bodies. Ketone bodies are certain things which are formed chemically and then they form acid also. So there is an acidotic reaction, ketotic reaction which occurs at the level of the cells, and the patient starts feeling lethargic, weak, is too drowsy. So this is a medical emergency. Definitely needs to be coming and getting treated at the hospital.
Um, Doctor, there are men. I mean, there are certain characteristics men have. They go to work. They have a lot of stress levels. They work in corporates or at different levels in an office. And then women have a different lifestyle. Like typically, if we look at either working women, uh, where they're trying to manage home, family, and then also working, and there are housewives. So, do you see any lifestyle? What causes diabetes in
Yeah,
these two
yeah.
categories or three categories? I would
So,
say.
yeah. So if you look at men distribution who are working in the IT culture, so what we see an added stress level one. So stress definitely contributes to diabetes. So there are new studies which have definitely told stress contributes to diabetes. Second thing is the habits. So what we have seen is their food habits are not very stringent. So they cannot follow food habits. So they, are onto that junk which is available at around their canteen, or they are, busy with their laptop and having it. That's what we have seen. And what we have seen is their added habits like smoking and alcohol. So that content increases with the level of stress and so on and so forth. So that also contributes to your worsening of diabetes. So there are studies which say smoking and alcohol cause some amount of weight gain. So weight gain, alcohol causes weight gain and causes the levels going high. But there are again contrary reports that if you take alcohol in over an excess amount and you take insulin, you might end up with a bad hypoglycemia, because alcoholics are prone more to hypoglycemia in relation to stress and this. In coming on to the women, so what we have seen is women to men ratio. When you look at, the incidence is more with the men actually, and women are less affected with diabetes. Second thing is the complication rates are much more in women who are post-menopausal. So once a lady achieves that steady state or her periods are off, we have seen more complications with post-menopausal women with diabetes. So the increased risk of other complications increase in post-menopausal women. In younger women, we advise them to have good exercise pattern. So be it irrespective men and women. So if you want to be out of diabetes, you have a family history of diabetes. Your parents are, both parents are diabetic. So you have a risk of about say 50% to get diabetes. So we identify certain individuals who are at high risk of diabetes and ask them to start following the regimes very strictly. So they should have a strict regime of diet, exercise, and have a steady, proper meal timing, and should keep regularly checking their stuff. Regularly checking their blood sugars is what my opinion is.
So, friends, in the meanwhile, I have a couple of questions. But if you have questions, all the viewers who are watching this live, do post your questions so that I can ask doctor while we are live. So, your next question, doctor. Is it recommended now? There is COVID. A lot of people who are diabetic are having a dilemma. बाहर से check कराएंगे कि नहीं? Should I go for a blood checkup, which is supposed to be their routine? So, what do you suggest?
See, absolutely, I'll tell you now. In terms of this COVID pandemic, as we all know, see, it's a dictum rule that if you are following all the precautionary measures, you will not get COVID. So either you go to that lab and get it done, or you call someone to collect it, or the best thing, if you are the most scared person, do not want to go, use a glucometer. So the glucometer might show 10% lesser range. If you look at to the lab value, we see that the acceptable range of difference between the lab and the glucometer is a 10% lower range.
Okay.
So the glucometer might underreport your value of say about 10%. If you want an authenticate report, we should be bold. I think we have to move on because we have moved on with 7 months of COVID and this is going to be there. So my sincere suggestion to all my viewers is please get back to normal. Only have precautions in mind. Follow these precautions and you should move on with life.
Okay. So they can basically order this glucometer or
Yes,
do it
absolutely.
themselves.
Now everything is online, or get a standard glucometer. So standard glucometer should be fine.
Okay.
And they should, the one watchful thing is, please look for the expiry. So there are certain expiries mentioned on the strips of the glucometer which come in. So what I have seen is patients have been using these strips for say about 6 years, 8 years or so on and so forth. So no, you have you have an expiry date. So please adhere to the expiry and then discard those strips which you are going to use.
So, doctor, most of the clinics are like not open. I mean, some doctors are opening their clinics, some are doing teleconsulting. So, what is your approach? Are you?
Yeah. So my approach now is I am using teleconsultation as a medium. So it's a fantastic medium. So why I'm using this is in chronic diseases like diabetes, you have a follow-up patient who can connect to me. So see, there were certain guidelines till 2020. MCI never approved telemedicine as a whole. But in 2020, it has approved telemedicine with a few, inverted comma marks, which the doctors and the patients have to follow. So I connect to my patients every day on telemedicine, and the compliance is much more better. So, they can contact me as easy as before. They are across this. So they are, saving their resources on traveling to my clinic, saving their time sitting across my, waiting room for their turn to come in. They are saving their risk of getting a COVID in by chance coming, out and contracting it somewhere. So they are at home. I am across this. I have to see their reports. I talk to them. Only one glitch is sometimes the physical examination glitch definitely comes in where I would want to examine. That's my main thing which comes in. But yes, in most of my cases, 90% of my cases, we usually do not require a general physical exam in every case. So if it's a well-controlled case, I would not want to examine them. And now everything. So you even have a BP apparatus which is at home. You have a weight machine at home. So what I advise my patients is please have a glucometer handy, blood pressure machine handy, and a weighing scale handy. So these three things. Now the technology has gone so far ahead, Ravi Shankar Saab, we have glucometers which connect to my laptop. So the moment the patient takes a reading, I can see that glucometer reading flashing on my screen. Or we also have certain glucometers, certain sensors which are coming in Indian market where we put it on our arm. That's called as an ambulatory glucose monitor. which records sugars every 5 minutes continuously, keeps the data into that sensor, and then with a reader, you get a graph-like picture that how many sugars were above the mean, below the mean. So it has markedly changed our diabetes management in terms
Wow.
for patients also and terms for us also.
So without pricking, you can they can actually check.
Yes. So it's just a single prick. So it
Okay.
stays, that sensor stays for 14 days. You can swim, jog, bath, do everything. It's a normal. It's just going to stay there with the tape. It will not even be paining you. We have certain of my patients who are on this for maybe 7 years. So every 14 days they are changing, and then I'm getting the reading. So I have a graph which comes like that, where it shows how many readings are above the mean which I have set for them, below the mean. So for certain individuals who are using insulin, I can know what time they had a hypoglycemia, so I can titrate the dose for them very easily. So technology has remarkably changed our management also, and for the patient also. So when everything is coming to your home, we are also coming to your home. So this is first time maybe in the world or in India, your doctor is sitting across you, and he's just right there in front of you.
True. True. I think, so have the prices reduced for some of these equipments and technology which you have spoken of? Is it affordable?
So see, yeah, this is absolutely affordable. The market retail price would be around 2,500 to 3,000 for 14 days.
Wow,
So
that's pretty reasonable. Okay.
it's pretty reasonable, and it's recording every 5 minutes. It's continuously recording. So I have a reader. I can give it to my patient. The patient can just scan it and put it across the laptop. He gets a summary. So he will get a day-to-day summary. He will get a 14-day summary cumulative. I will also have time in range. So there is something called as time in range, which will show very clearly that if I had set 180, 160, how many values were above. So it shows like a graph every time.
So
It is
as a patient
fantastic.
also, I will know what I have eaten,
Yes,
high,
yes,
what are the things I need to control, what's working for me,
yes,
what's not working for me. Maybe
yes. So
a banana didn't work
yeah,
after a meal or something I can, reduce.
yes,
That's a
yeah.
very good.
So we have a lot of old patients
Hmm.
who unknowingly see. So what happens with hypoglycemia is lot of our patients who are chronic diabetes and long-standing diabetes do not get these warning signs of hypoglycemia, because there is something called as a autonomic failure which occurs in a long-standing diabetes. So they, without any symptom, can have a silent hypoglycemia. So these individuals are more happy because we can catch them. We can catch that hypoglycemia which is silent at night. It's recorded. So next day I know that I have to reduce the value.
Got it.
So it's fantastic. So this tool has revolutionized the type 1 diabetes management also, because children carry to school and go, they come back, the mothers know what the child has skipped in, or had chocolate, and so on and so forth. So this sensor, the continuous glucose monitoring, the flash glucose monitor, have absolutely revolutionized. The other revolutionary things which have revolutionized the diabetes management is an insulin pump.
Hmm.
So there are dual pumps. Now there are insulin pumps which continuously deliver insulin at a static rate. And there are also newer pumps where it delivers both glucagon and insulin. So what does glucagon do is, if a patient has a hypoglycemia, it senses. The pump senses, automatically alarm comes in and glucagon is pushed in. So glucagon was the same injection which I talked about to be
Hmm.
given for children who have low sugar. So dual pumps have also come in. They can just be put it at their abdomen level, the sensor and the tubing. So this is how technology has revolutionized diabetes management per se.
You just have to know what should work for you and consult a doctor and opt for. I mean, if you can afford it,
Definitely.
this is
Yeah.
something which will at least monitor that for a while, and then you can change your
So nowadays
habits.
everything is on EMI. So these pumps have also been coming on EMI. So
Hmm.
maybe as low as maybe 10,000 a month, 12,000 a month. Certain of the companies are giving it at EMI. So certain companies give it as demo versions also.
Okay.
So they can site on rent. They do not need to purchase it.
Purchase.
If they want to test it, they can take it on rent for a certain month, and then if they are comfortable, they can purchase it. So
Hmm.
that's how
That's
the
a good option.
technology is.
Yeah. So we have some questions, sir. This is a
Yeah,
question
yeah,
from Mrs. Vijay Durga. After recovery from COVID, what diet and what problems we will face and what practice should we do?
yeah. So, post recovery of COVID, I would suggest my patients to have a healthy diet, like have a vitamin rich diet. So, see, everything concept of diet comes in from immunity building. So, immune building foods have to continue because there are certain case reports, not to scare anyone, but reinfection. That is, certain of the case reports are coming from world where patients are again getting a COVID. Very, very unlikely, very minute levels of chances of getting it, but definitely go on to a normal diet what you are having. Increase your vitamin C content in the form of citrus fruits, because
Mhm.
citrus fruits are again safe in diabetes. You can have an amla, you can have a mosambi, you can have an orange, you can have an apple, you can have a papaya single slice. Start doing, yoga was the traditional Indian form of exercise which had come in. So please kindly do that yoga at home. So best exercise is yoga, or the simplest exercise would be, climbing stairs if you are not too old, up and down, or else just to push sit-ups. Maybe 10 to 20 sit-ups, or just use a bathroom stool to do that step up, step down
Step.
exercise. 20, 15 to 20. So these exercises will keep you healthy. So immunity should be strong. Willpower. So mental health is also very important. Do not get anxious. Do not get panic. Panic will, create a lot of havoc.
Yeah.
So half of the world is 2020 is an year of anxiety. So people have gone into that anxious phase where they start, looking. Once a COVID patient definitely starts getting that havoc. That havoc and that anxiety has created an ecosystem of anxiety around you. Neighbors start joining in, then someone else starts joining in, the maid starts joining in. So it is not something, like a wildfire. Please do not be too anxious. If you get a COVID also and post recovery also, you will be fine. So 80% of our individuals who suffer with COVID have a very mild or asymptomatic disease. They do not even have symptoms, maybe. 20% have symptoms, might require hospitalization. Among those 20%, 10% might, 5% might go on to a ventilation and severe disease. In that 5% also, if you look at, only 1%, God forbidden, have a mortality. Otherwise, rest 4% come home. So it is such a big statistic that COVID is not going to do anything. It's just a viral disease. But yes, prevention is better than
Better.
cure.
Yeah, completely. So, continuation of the same question from Mrs. Vijay Durga. What precautions shall we take? I am taking 12 units of Lentils and Zorla, M2 Fort. I'm assuming
Okay.
these are the medicines.
Okay. Okay. So it wouldn't be ethically right to talk about the medications on the program.
Hmm.
So, madam, I would suggest you to kindly connect to me through my, appointment list, or, looking at my name. But yes, definitely precautions. I would advise you to, check your sugars frequently, like at least weekly, twice or so. You can please use a glucometer to check your sugars. Keep your sugars, around 160 postprandial, that is after food. Before food, keep it around 80 to 130. But yes, for any other discussion on this, I would request you to please kindly connect to me in person.
Sure. So, thank you, Vijay Durgaji, for these questions. Next question is from Archana. How is that COVID recovered patients are getting infected again? So,
Yes.
I think this
So
is going in the news for a while.
yes, there are few studies which in India have said that a certain of the individuals do not develop antibodies.
Mhm.
Still, it is very new because the disease itself is new. So reinfection prospectively in a viral infection is not known. But certain of the individuals, like HBS, HBV, and hepatitis virus and all, there are reinfection chances which can happen. So definitely, there are certain minute chances, maybe 1% or less than 1% can have a reinfection. Why? We still need to have a lot of discussions on it. It is still very immature and premature to comment on this.
This is a question from Madeline. Once a person gets thyroid, will it remain with them forever?
Yeah. So yes, if it's a primary hypothyroidism, which is seen mostly in women, and it usually tends to remain in your body, it is for life, because your gland is not functioning properly. So the gland, the number of cells, see, suppose I am developing thyroid today, my gland has about 1 lakh cells. Over time, the cell is getting dead. The cell, so 1 lakh is going to go 80,000, 80,000 is going to go 70, 60, and so on and so forth. So the innate, the body which is producing X amount of thyroid hormone, slowly the hormone production is getting lesser because the cells are dying. So the dose also will go on to go increase slowly and remain to a plateau level. So definitely it is going to be a lifelong, hormone replacement. So I never comment on saying it is a hypothyroidism treatment. I say it is replacement. So we are replacing the hormone from outside. So definitely, yes, it tends to be there.
What are the side effects for taking medications or for diabetes or insulin? Because common saying, एक बार शुरू कर दिया तो you have to continue that for life. So
Uh,
what's your
that's
take
again,
on that?
yeah, that's again a misconception for insulin. एक बार शुरू कर दिया तो कभी थोड़े थोड़े दिनों के लिए we keep it and then we stop it also. So that's one. Yes, side effects. The biggest side effect can be hypoglycemia, sugars going low. The other side effects, certain of the medications like metformin cause some amount of gastric bloating, cause some amount of acid gastritis, that is your irritation or burping or feeling full and so on and so forth. The most common side effects again, if you are on an SGLT2 inhibitor, that is your newer class of drugs that causes a lot of UTI infections. It can cause genitourinary tract infections, that is your urinary tract infection. These are the some of the side effects. Insulin, yes. Insulin, the only side effect is hypoglycemia.
So why is that PAN or anti-acid medicine is nowadays given by default for any medication as a उसको पहले
Uh,
खाओ फिर बाद में might not be. I
that
mean, maybe
maybe,
this is not a
yeah,
relevant question
yeah,
for diabetes, but
yeah. Maybe I am not sure why it is done because maybe most of the medications have a base of preparation of pharmaceutical base that could cause some sort of gastritis. So in India, if you look at 40% to 50% of the individuals, they complain of subtle gastritis kind of component in Telangana basically and in Andhra also because of our diet pattern. So what you look at, if you go towards our rural areas, there is still the rich mirchi culture which is there. So I used to be there in around Nalgonda, so I used to see that people used to mix a lot of lal mirchi, that red chili with rice and raw and eat it. So obviously, when we are eating such a spicy food, definitely maybe my, the GI tract would be irritated and cause a lot of gastritis. So that's how it is.
so this question is an extension from Adeline. Since you are also an endocrinologist, what are the things we shouldn't eat?
Eat in terms
I
for
think she meant for thyroid because the last question
okay,
was related to
thyroid, yeah.
thyroid.
Thyroid, see, thyroid के लिए cauliflower, cabbage, soya broccoli, these are all to be taken in lesser quantities. So now, if you look at studies again, see, everything comes from a scientific data. No one in the world has said if I eat 10 cabbages, what will happen, and if I eat one cabbage, what will happen. So that's why I tell use it in a lesser quantity. Maybe weekly once you can have it. So
Okay.
do not point blank stop it, but yes, you can have it in lesser quantities.
The next question is from Sirisha. My many mothers are developing gestational diabetes during pregnancy. How is it possible for her to avoid it in future?
So that's what. So now gestational diabetes, about 10 to 20, 18% can develop into type 2 diabetes. So see,
Hmm.
suppose someone of my relative is a pregnant woman, develops a gestational diabetes, has gained overweight,
Hmm.
has not followed diet, delivered, post delivery still has not reduced weight, is following an erratic diet pattern, there is a risk of that lady or mother to 18% of such mothers can develop a type 2 diabetes. So they are getting converted pregnancy related diabetes to type 2 diabetes, and then there is a chance of about 20% of the mothers to get a diabetes in the second pregnancy. So if a lady is pregnant in the first pregnancy, she gets diabetes. there is a 20% risk that she might develop a gestational diabetes in the second pregnancy. And in these normal patients who have gestation-induced diabetes, 18% of the ladies might go on to develop type 2 diabetes, which is again going to be there for life. So the goal in such patients who have gestational diabetes is post-delivery exercise, diet pattern should be regular, because your body has got an insult of gestational diabetes. You might get a risk, or there is an increased risk of you to develop a type 2 diabetes.
So, is there a possibility for the child to develop diabetes in future because the
No,
mother has gone through
unlikely,
gestation?
unlikely. Gestation mother, no, unlikely. It is conversely, the child can get a neonatal hypoglycemia, but no.
So, other functions like high cholesterol, high blood pressure, combination of that with
Yeah,
diabetes.
yeah,
A lot of people
yeah,
have this
yeah.
combination, just not diabetes. So, what are the side
Yes.
effects for that?
So, yes. So, other contributors or other risk factors in diabetes is high blood pressure. So, keep your blood pressure around 130/80. All right. Keep your LDL cholesterol around 70. So, LDL cholesterol is a bad cholesterol. In diabetes, we see a lot of hypertriglyceridemia, where that is the triglyceride levels are too high because of the diet pattern also and the high sugars also. And the second most commonest is LDL, which is a bad cholesterol. That should be kept less than 70. Avoid smoking. And if you are having complications of diabetes, please keep a regular check. Like, if you have, you are having burning sensation in your feet, or your slippers are just falling off, or, you are visiting a temple,
Hmm.
please kindly do not. So what I see a lot of common people is old patients who go to a temple walking on this heat, heat flooring, hot flooring, and then they develop ulcers. So what happens basically in diabetes is the sensation, the thermal sensation. So the temperature is, the thermal sensation of their feet loses. So they cannot sense if it's warm or cold. And then they develop these big ulcerations or wounds on their feet. So diabetic foot care is very important. So before you take a bath, please use your hand to look for the temperature of the water. If it's very hot, please kindly mix up the normal, keep it at room temperature. After bathing, wipe your body and the foot with a proper towel, giving due consideration to your interdigital spaces. So your interdigital spaces are the spaces which are between the toes or your fingers. These are the most common spaces where you can get infected. So these interdigital spaces have to be wiped properly. Use a moisturizer cream or something called as Moisturex, which is rich in urea, for keeping your foot not getting dry. So what happens is there is dryness in your foot that leads to cracks, and cracks give way to your infective pathologies or infective bacteria into your foot and causing a foot infection. So this is the most common presentation I see.
Got it, sir. So, how often should patients, diabetic patients, visit the doctor, consult the doctor? What frequency is it?
So yes, so if my patient is on two consecutive visits, maintaining range within normal limits, I would call them every 6 months. But if my patient is not being under good control or is not being, with good HbA1c, I would call them every 3 months. And a newly diagnosed patient, I call them after 4 weeks of diagnosis. So 4 weeks of at diagnosis, 3 monthly if you are 3 monthly if you are poorly controlled, 6 monthly if you are well controlled, 6 monthly to 1 year based on patient basis. And also every year I ask them to do a complication workup for their retina, for their foot, and also their other major complications.
So, doctor, supermarkets, shopping in supermarkets are very lucrative, and you have a
Yeah,
lot of
yeah.
colorful stuff displayed, packed foods that displayed out there. What are the things we should avoid from the supermarkets, especially
So
for patients?
yeah. So anything white is not good for diabetes. Be it maida, be it sugar, be it rice. So all white, these are the whites basically you will have to concentrate. So maida is not good, corn flour is not good, sugar is not good, rice is not good. So anything which is white bread per se also is not good. So anything white, please avoid, but not too colorful. Colorful because the chocolate packings are very colorful. So please avoid chocolate. So how do you plan your supermarket shopping? So if I get into that supermarket store, my first eye should be on these superfoods such as these millet-based diets, these ragi-based diets, and certain brown rice. So parboiled rice is very good. So if you look at fruits, your fruits should contain low glycemic index or medium glycemic index foods such as apples, kiwis, oranges. Then you can have apples. Once a while, one mango, half mango, I would say okay. Once a while, one banana is okay. See, we are human beings. The more I say no, the more we would want to do it. So I suggest that you have it in moderation. Once a time, once a week is okay. Brown bread is perfect. So brown bread two slices, and that too with studded grains. Now, if we tell bread, what happens is I have seen a lot of my patients saying bread doesn't mean four slices or five slices, maximum by two. Rice doesn't mean a full bowl of rice. It means one cup rice in the afternoon. Fruits doesn't mean at night. I would ask them to take it around 11:30. Use a sugar free like stevia. So you should use a sugar free which is plant-based product called stevia. Avoid your refined. So now oil. A lot of my patients ask which oil can I use for cooking. So if you look at literature, olive oil is very good. That too in that virgin olive oil is good. And you can also use sunflower oil because it has been since a longer time. So avoid this coconut oil, groundnut oil you can avoid. You can avoid the groundnut and coconut oil, not good basically for the heart and diabetes. So this would be an ideal supermarket tour which I have given you that choose a go into your brown section more, go into your pulses section more, go into your gram section more. Forget those jellies, jams, sweets, and those attractive packing biscuits because biscuits are also made of maida. So no biscuit in the universe is sugar free. So take home should be no biscuit in this universe is sugar free. If you just turn up the wrapper, you will have some amount of carbohydrates. So that's how is the supermarket store.
So, what about dry fruits? A lot of people feel that dry fruits good. So, this is just hog dry fruits.
Yeah. So now cashews are not good because cashews are again rich in cholesterol. So it's not good. You can have certain those akhroat kind of features or fig sometime one and two can be okay. You can have a badam. You can avoid pista, avoid cashew nuts, avoid kishmish. These are not good for health. These are not good for health. So please avoid those. You can have all these. Although sometimes avocados can be taken, but not very regularly. Dry fruit again, you can just take it in moderation, but avoid these anjis and all and so on.
So, next question: elderly people with diabetes for a long time have their vision, and vision. They lose their vision eventually, and they're also losing the balance. So, what are the precautions for them? Any changes? Anything?
Yes. Yes, so diabetes, see, now diabetes, as I already told, has some retinal problems. So in retinal problems, your vision starts losing because your vision measure. One is your vision, you are unable to see properly. More so in the night, that is also with diabetes.
True.
And your gait, that is your style of walking, alters with diabetes because the loss of spinal axis or the spinal nerves which are supplying your foot are lost. So the central versus your peripheral axis is lost, and they have that that ataxic gait. So for such old patients, I would ask you to have a caretaker for them.
Okay.
Because they are more prone to have falls. So if a old patient falls down, he or her is more prone to have a fracture, and this all can lead to a complication.
Got it. So, what are the small changes that they can bring in uh, these
Okay.
elderly people so that their vision is proper? Or
See now one thing is Raviji, what happens is you have to tackle all this early. That's what happens. A lot of our patients neglect it at the earlier phase because they start relative shopping. So relative shopping is a very common thing in India.
Okay.
I speak to my relative becomes an added doctor. Then I speak to another relative, he starts becoming the super doctor to the other relative. So we do a relative shopping for maybe 1 2 years. Then we become self self reliant. We start becoming self practical. We do not want to believe. Now we have an added doctor in our life is a Google doctor, Google Baba, who
Hmm.
gives out a lot of things. So this has all contributed, and then when they come into our practice, they have already come into an advanced stage. So my sincere request to all my viewers is please come early, where I have time, where I have options for giving to you, and I can help you, and not coming late where I am helpless and I guess I have to be sorry.
I completely agree with you. A lot of gyan that is shared, online, and
Yeah.
contradicting
So the
statements.
GAN which is shared online is not filtered. So we do not have no any filtration in the GAN because everyone has a YouTube access, everyone has a laptop and phone, everyone makes a video.
Yeah, got it, sir. So, Dr. Amit, thanks a lot for sharing
Thank
your
you so much.
insights and spending time with us and the audience to clarify a lot
Yeah.
of questions. I'm sure this will be very helpful because a lot of us have this dilemma: bahar nahi ja sakte, doctor ke paas nahi jana, continue the same medicine, not consult. But this tele medicine option is available, so they can consult the doctors. They can have the conversation as we had today and clear all their doubts and continue or change their medication as per the recommendation. So thanks a lot, audience, for joining in. Do follow, and Dr. Amit is also there, available. On the social handles, we'll share that, so you can connect with him, take an appointment, consult with him, and then do since it is teleconsultation, you can basically consult him from anywhere across the world. So there are no barriers right now. So feel free to reach out for any questions. And thanks a lot. Thanks a lot, Dr. Amit. It's a nice
Thank you.
conversation. I
Thank
learned a
you
lot
so
myself.
much. Thank you so much, Ravi Shankarji, for getting me onto your show. Work TV is an amazing platform. I wish
Thank you.
all the success and endeavors for Work TV, all your team, Pulse Pharmaceuticals for making this show happen. And I'm very glad to all the people who joined our show today. I am indebted and very thankful to all of you because without all of you, we doctors are no one. So my client, my patient is everything to me. So I dedicate, I honor, I thank everyone for joining me today evening. Thank you. Thank you once again for having me on this show.
Thank you. Thank you, sir. Thanks a lot.
Thank
Thank
you.
you,
Bye.
viewers.